Hi guys, welcome back to my channel. After my last video about when to request your epidural during labor, I got a lot more questions about labor epidurals, so I figured I would answer them another one today. If you haven't seen that first video, like I already mentioned, it was about when to request your labor epidural. It talks about how dilated you have to be, what things to consider when requesting your epidural. Make sure you check that video out, and if you like it, give it a like. You can also see it on my blog at www.sarahrecmd.com under Mom Life. So today, the question that I got asked, I probably got asked this 30 times after releasing that video, and this question is, can I get back pain from the epidural? So not only was I asked this question a lot after releasing my last video, but I get asked it all the time when I go in patients' room to place epidurals, and I very, very commonly see it on motherhood forums and mom blogs that you can find out there on the internet. So I think it is a great question and a really important question to address. So the answer to this, can I get back pain from the epidural? Yes, you can get some short-term back pain, but very, very infrequently do you get long-term back pain from an epidural. So let me start with that short-term back pain. So when we place the epidural, we have to use a needle to get into the epidural space. And just like anytime you have a procedure or a needle is used, so say you get an IV placed, or you have a blood draw, or you have surgery, all of those procedures do cause some trauma to the tissue, the body tissue. And anytime we cause trauma to the body tissue, you're going to have some pain and inflammation associated with that. So an epidural is a medical procedure. We do have to use that needle to go through the skin, the subcutaneous tissue, and a couple of other ligamentous layers in the back in order to get to the epidural space. Naturally, that needle does cause a little bit of tissue trauma, and that tissue trauma leads to bruising. So you bump your leg, you get a bruise, you touch it, that bruise hurts. It's the same thing that happens with the epidural. Obviously, we're as gentle as we can, but that's just the nature of any procedure that happens in the body. So it's very, very common to have some back pain, just kind of point tenderness pain when you push on that spot where the epidural was for a couple of days after having the epidural placed. It usually abates within 2 to 3 days after delivery. So short term, yeah, you can get that bruising type pain right at that site of the epidural. As far as long-term back pain, which is really what people are asking when they ask this question, can I get back pain from the epidural? Can you get long-term back pain from the epidural? Quite honestly, you guys, it's extremely rare for that to happen. And the reason for that is that we don't actually do anything. The epidural doesn't touch the nerves. It doesn't go into the spinal cord, which is kind of a common misconception. The epidural actually sits in a space before you get to the spinal cord. So we're not really going around the nerves or into the spinal cord. So you don't get any long-term, and I shouldn't say that, it's very, very rare to get any long-term nerve pain or back pain from the epidural. But there are a lot of reasons that women have back pain during pregnancy that continue after pregnancy. And those are the things that really contribute to back pain after having the baby. And I think that's what people really think is that, I'm having back pain after I had the baby, so of course it's something from delivery. But let's talk about the reasons that you get back pain during pregnancy that continue after pregnancy. So the first thing I want to talk about is that when you're pregnant, you get some increase in your lumbar lordosis. And what that means is that the vertebral column has a couple of natural curves to it. If you look at somebody standing upright, you'll see that the spinal cord it has two different C shapes in it. And when you look at the low back or the lumbar back, which is where we place the epidural, you have a lot of curvature in that part of your back. And when you're pregnant, that curvature actually naturally increases. If you look at a picture of somebody sideways before they're pregnant and during the pregnancy, you'll see an increase in that curvature in the low part of that spine. Well, the changing of the body and the joints and the ligaments and the musculature naturally causes some back pain. So after delivery, that lumbar lordosis does go back to normal, but just like with anything, body changes, they can cause some pain. So kind of the realigning of all of those muscles and ligaments can contribute to some back pain. So the second thing that I want to talk about that contributes to back pain, again, both during pregnancy and persists afterwards, is just the weakening of the core. As the uterus expands, we all know that the core muscles, the abdominal muscles, get very, very weak. I can attest to that. I've had 4 kids, and my core is definitely not what it was before I had kids, despite the fact that I work on it a lot. And so immediately after having a baby, everything doesn't snap right back. We still consider a woman to be postpartum for, post-delivery for 6 weeks after she has a baby. And it takes even longer than that for the body to completely reverse all of the changes that happen during pregnancy. So the core is a huge contributor to posture, and posture is a huge contributor to back pain. So naturally, with a very weak core, and then, for 6 weeks after delivery, OBGYNs tell patients not to do any strenuous exercise. So there's a little bit of time that occurs in there before a woman is even able to start exercising and strengthening that core a lot. And so that weak core contributes to back pain. It's very, very common. So, that's another big thing to consider, is that, those core muscles, those weak core muscles, do lead to back pain. So the third thing I want to talk about related to the core is poor posture. So I'm going to admit this, I have horrible posture, and definitely during pregnancy and afterwards, as I was trying, I was exhausted. I wasn't, sitting in a chair nursing the baby, and you're kind of trying to get comfortable with the baby. I don't think most women who are nursing babies and who are exhausted are sitting straight upright with great posture and tight cores and all that other good stuff. And so that poor posture also leads to back pain. So you've kind of got all these contributors to things that naturally lead to back pain. And then you add into it exhaustion and poor posture, and that's naturally going to continue to give you some back pain. And then the last thing that I want to mention is just naturally people who are overweight, and I'm not saying as a pregnant woman you're overweight, but naturally being overweight does contribute to back pain. It's just more pressure on all of those joints in your spinal cord that leads to back pain. And most women gain between a minimum of 20 pounds during pregnancy, and even if you're not overweight during that time, that increased weight can lead to some back pain. So the thing that I want to reiterate is that we've come up with a lot of reasons. The changes in the lumbar spine, the weakening of the core, poor posture, and weight gain, all of which contribute to back pain during pregnancy. Those things don't immediately reverse after you have the baby. It takes a fair amount of time for your body to make all of those changes back to the pre-pregnancy state. And so a lot of women will have back pain after delivery. They had back pain during pregnancy. They're going to continue to have back pain after delivery. And a lot of times they'll have more back pain because now you're not sleeping and you have poor posture, and exhaustion tends to exacerbate things. And so I think more than saying that the epidural caused back pain, just in general, pregnancy and being in the postpartum state and exhaustion contribute a lot to back pain. Now, again, I'm not going to tell you that there's 0 cases of the epidural leading to back pain during, after having the epidural placed, but more than likely, the back pain is due to all of those other things. So the best thing you can do if you're experiencing back pain after delivery, obviously, number one, talk to your OBGYN and make sure nothing else is going on. And the anesthesiologist is always happy to take a peek and make sure there isn't anything else going on from an epidural standpoint. But more than likely, the big thing is that you just need to work on posture, work on core strength, work on losing some of the baby weight, which I'm not saying try to lose all the baby weight right away, but getting back to your pre-pregnancy weight, and exercising. And all of those things are naturally going to strengthen the hips, the pelvis, the back, and reverse that back pain. And if it's really severe, talking about doing some physical therapy or something to work on strengthening is going to definitely help you. So if you're having back pain after delivery, is it from the epidural? Quite honestly, probably not. It's probably just from all of those changes your body undergoes during pregnancy. And they're just things that every woman has to work on, and a lot of people have to work on in general, pregnancy or not, to decrease back pain. Chronic back pain is a very serious problem in our country. It's a very frequent reason why people go into the doctor in general. So to say that an epidural is causing back pain, I think can be a little bit preliminary, and we need to just remember all of those other things that can be contributing to back pain and focus on those things, doing the exercises, doing some physical therapy, and making sure that's not it before blaming it automatically on the epidural. So I hope that that was helpful to everybody, and if you have any questions about epidurals, I would love to answer some more of these. It's one of my favorite topics. And make sure if you found this video useful, you like the video and subscribe to my channel, and make sure to check me out on my website at www.sarahreckmd.com or follow me on Instagram at the same handle. All right, have a great day.